Yesterday, National Health Minister Dr. Motsoaledi admitted that the country's healthcare system is in distress due to the burden of diseases. He also agreed that the system is overloaded partly due to patients from the neighbouring states using the country's hospitals. The minister's address followed comments made by Health Ombudsman Malegapuru Makgoba about the critical state of our health system that is at the brinks of collapse. We are now crossing to Patricia Kupane, the DA Shadow Minister for Health, who is joining us from our parliamentary studios. Patricia, good to have you. Thank you very, very much for joining us on Morning Live.
Good morning, Leanne, and thank you so much for having me this morning.
So part of your portfolio as the Shadow Minister, you visit, you collect information within the health sector. What is your assessment of, let's say, the health of the health sector in South Africa?
Leanne, what is important, during my oversight, together with my spokesperson in different provinces, our findings during the oversight visit, we really realized that our healthcare system is on a verge of collapse, like the Health Ombudsman just said. It is true. The problem emanating to that, it is because we don't have enough nurses and doctors in our healthcare system. That is the most unfortunate situation. When I was in KZN, let me say from 2016, my colleague, Dr. Kika, he wrote to the Human Rights Commission to say there is a complete failure of oncology services in KZN to provide service to oncology patients. And it came through out of the report. And both the minister, the provincial department, they were squarely blamed. And now, since 2016 to date, there are about 499 patients that have died in the KZN because they couldn't get the oncology service on the time that was expected. In KZN, patients still wait about 5 months before they can see oncology. They wait about a year before they could get a radiation. So it clearly shows that this is a crisis.
Yeah, indeed.
In a hospital
and
where
those time periods are too long. They certainly are. I mean, at that point, I'm sure you may have already lost your patient if you're waiting for a year to have radiation or just to even see an oncologist. What I'm gathering from you is very much so something that's very contradictory of what the minister has said, because the minister has said that it is only the Northwest province that he feels that the health sector has collapsed there. But you are highlighting KZN. Are there other provinces that you have found are in a very, very dire situation too?
Free State is one of the provinces. This Monday, I was in Bongani Hospital. Bongani Hospital is having a renal unit. Since the inception of that hospital 20 years ago, the renal unit and the renal plant never becomes operational. Renal plant is where they purify the water to be used for dialysis. The renal plant, it was never used, and now the hospitals, they are using the two mobile device to do the dialysis. And in that unit, according to the norms and standard, they were supposed to have about 9 nephrology nurses who can do the dialysis. But unfortunately, they are only using one sister who's trained. The rest are not trained, and they are short-staffed. And currently, they can only dialyze about 8 patients. But if the plant wasn't used, they could have at least dialyzed about 23 patients. So it clearly shows that there's a crisis. The very same hospital, they have about 9 operating theaters. Because of lack of equipment, there is no surgeons. Now what happened? All 6 operating theaters have to be closed. Only 3 theaters, they are open, but still the theater tables, the hospital put a tender, give the tender to Ezweni. Ezweni was given the money to buy the theater tables. Yeah. On arrival, the very same Ezweni, they couldn't even assemble the beds that they bought from China. The hospital couldn't use them. That's why the theater was closed. Yeah. So those are the things that we are worried about.
Yeah, I mean, these are the kind of stories, sorry to interrupt you, it's just we've got limited time. And these are the stories you don't want to hear when money is being spent on things that are just not being utilized. And we talk about these, the kind of equipment, and I mean, we've tried to get through the majority of provinces, but we see that the Health Ombudsman is actually in the eastern Eastern Cape, and he's particularly taking a look at the Tower Mental Hospital. He's saying that the head office is now deploying 200 managers to the respective provinces. Do you think this is going to help? Can this alleviate the situation?
Leanne, let me say this. The minister, he failed himself to do oversight to all these provinces. That is the starting point. He must accept that he has failed. There were warning signs. The AG briefed the committee. The Office of Standard and Compliances, yesterday they briefed us. They give the report to the minister to highlight all the problems that I'm mentioning here today. It's not something new. We do appreciate any little effort that is trying to do, but the reality, that is not going to solve the problem. Because something that we need to understand, the problem of our healthcare system, it is not the money. We do have about 205 billion. We spend more than other countries, the developing countries like South Africa, but we don't have the good outcomes as compared to other countries. If you remember now, the new report of the 2018 Global Competitiveness Report, it clearly shows South Africa were the highest when they check the prevalence of TB, and we spend a lot of money. We are now ranked the top worst country when compared to other countries in terms of the life expectancy. The problem is the financial management, mismanagement. We not manage our finance correctly. Corruption is one of the things that we have to deal with, and a lack of consequences.
Let's just finally wrap this up on a look into the future, because NHI is coming. Government is preparing for the ushering in of this. Should South Africans be worried? I mean, if this is what our health system looks like now, what this picture you're painting for us, the national health insurance, I mean, is this going to be the answer? Is the system going to work? Or are we going to now see an entire collapse of our health system?
Leanne, to be honest with you, NHI is not going to wipe all these problems that we have just indicated. We have to be worried. Until such time there's enough people who are trained to do the job, until such time the hospitals who are having the CEOs that are having the clinical background to run our healthcare system, until such time we have enough primary healthcare clinic, because currently in our country, based on our history also, people still have to travel 5 kilometers to access health. And the other thing that is a problem, that is not going to make the healthcare, the NHI to be functional. Our own government, Department of Health, is not willing to work with the private sector. You know, I know, the private sector have the resources, the human capital, the doctors are there, the equipments are there. Why government is not working close with the private sector? That's why even the pilot projects, they have failed in other areas, because private sector was never being in place. And people were never even paid the money who were even employed in those pilot projects. So clearly it shows here there's a poor lack of leadership to change the situation.
All right, we leave it there for this morning. Thank you very, very much. That was our guest in our parliamentary studio, Patricia Kopane, the DA Shadow Minister for Health, talking to us about the state of the healthcare system here in South Africa.